And Australian Dragan Vasiljakovic has failed in his federal court appeal against an extradition request from the Croatian government. He's accused of committing war crimes in the Balkans in the 1990s. Those stories and all the day's news at 9:30.
It's the definitive guide to the best tracks on the best albums in every musical genre. Undisputed classics, undiscovered gems. 1,000 recordings to hear before you die. Out now at Dimmicks and bookstores.
The following program has been classified M. It is recommended for mature audiences. It contains adult themes.
My name is Michael Mosley, and in this series I have been tracing the glorious history of surgery and the magnificent cast of characters who have taken it from the Dark Ages and turned it into a precise, skillful and life-saving discipline. Hello. I've covered magnificent breakthroughs.
You had the tube hanging like a trunk.
Ideas that were inspired and those that were deranged. What you do is you bop it through the skull. But none of this would have been possible without 4 fundamental discoveries that would change the face of surgery forever. That's it, hold him down. Mapping human anatomy. Managing blood loss. Developing pain relief. Oh, God, that's horrible. And stopping infection. In this programme, I'm going back to surgery's crude beginnings, when it was little more than optimistic butchery. And I'll show you how surgery was utterly transformed into a discipline that for the first time would cure more people than it killed. I'm rather excited because I'm about to do something that I have been absolutely dying to do for years now. In the early days, surgeons were not exalted gods, but a rather lower form of pond life. Trained as barbers, they could purge, bleed or cut off a limb. Their most sophisticated tool, the blood-sucking leech. Right, so these are our friend the leeches, is that right?
These are the friends of leeches. Now, these are European leeches. We know that because they have got green tummies.
What?
Be careful.
Yeah.
I've got one made ready for you.
OK.
So if you put your arm on the table...
Yep.
And I'll put one in a wine glass. Ready?
Yep. Will this hurt, by the way, before?
It's a bit like dentistry, you know, the injection hurts, but then afterwards it doesn't.
Yeah.
Right, here we go.
Oh, yes.
Can you feel it?
Oh, I can feel it. Oh, jeez. Oh, yes. Oh, yes, I can feel those little teeth going in. It feels like about 300 or 400 very, very small teeth all drilling in. Oh, you little bugger. What did they use leeches for?
Basically, everything. If you were to lose your left leg, or you had a little headache, so by giving you a quick bleed, the idea was to make you feel better. Doctors might prescribe it, but bloodletting itself was mainly left to the unsophisticated barber surgeons. The European obsession with bloodletting goes back to the Greeks and their belief that an imbalance in any of the 4 humours, phlegm, yellow bile, black bile or blood, could cause sickness. If you believe that, then bloodletting was a logical treatment. I think this leech has acquired a taste for Mosley blood. If I lost enough blood, eventually my blood pressure and core temperature would both fall, leaving me pleasantly sleepy but anemic. Could be overbled. Yeah. Physicians will bleed you again and again and again and again over a course of weeks. Yeah. With a whole bunch of new leeches each time? Each time, yes. You could end up being bled to death. Oh, he's come off now. And I'm beginning to bleed. There he is, absolutely gorged with blood.
How much blood could I lose?
I would reckon you're going for about 4 to 5 hours.
Yeah.
And you could be looking at a good wine glassful plus.
Right, blood. Right, and this idea clearly persisted, despite the fact it's clearly nonsense. It persisted for thousands of years?
Thousands of years.
I'm going to drop another drop just...
Taken too far, bloodletting could and did kill. But it was still preferable to other treatments surgeons had to offer. That was butchery. Cutting out and chopping off.
Oh dear. It's good to be back in the 21st century. I've got a pressure bandage on, which is there because apparently I'm going to go on bleeding for a couple of more hours, and I've got my leech, who I'm going to take home to show the family, keep it as a family pet. But more importantly, I'm now going on the trail of the men who would eventually make the leech redundant and who would drag surgery kicking and screaming out of the dark ages.
Today, whether it's due to a car crash, cancer, or a heart attack,
Okay, we are getting faster forward. So you can send...
around 75% of us will, at some point, come under the surgeon's knife. "32-year-old cab driver Jason Harvey has fallen over and smashed his kneecap.
This man's suffered a fracture at the upper pole, as it's called, right at the apex of his kneecap. A fracture like this, before the days in which we could safely do surgery, would have significant repercussions on the patient's ability to walk, and it really would be a significant disability.
If Jason's operation is successful, then it will be largely thanks to 4 great breakthroughs, spanning 500 years of surgical advance and setback. The first of these breakthroughs was fundamental, understanding human anatomy. The first person to create really accurate drawings of the human body was the Renaissance genius Leonardo da Vinci. But he never published. So, well into the 16th century, doctors still relied for their understanding of anatomy on crude drawings done 1,300 years before.
It would take a Flemish dwarf called Andreas Vesalius to change that. Picture the scene. It's 1536. A criminal has been hung and left to rot on the gibbet. One evening, along comes Vesalius. He's a 22-year-old medical student. He looks up at the corpse with longing. Body snatching is illegal,